Hi, my name is Michelle Swartz. I am an education specialist at Cincinnati Children's Hospital and Ambulatory Specialty Services. During the next few minutes, I will give an overview of the poster titled Empowering Medical Assistants in Providing Standardized Patient Care, a Competency Model Approach. Cincinnati Children's Hospital is a 700-bed nonprofit academic medical center serving patients from all 50 states and 51 countries. During fiscal year 2018, Cincinnati Children's outpatient visits totaled more than 1 million across primary care and specialty services. At Cincinnati Children's, the medical assistant, or as we call them, the MA role, is becoming an integral part of healthcare team in the ambulatory setting and has increased exponentially over the past decade. Due to differences in state and organizational requirements, MAs arrive with different levels of training and expertise. Variations were noted by medical and nursing leadership across the organization regarding the role and utilization of the MA. Some of the variation noted was related to MA competency. The objective of the project was to ensure medical assistants across the organization begin orientation in their work area with a predictable skill set. Hence, the project was initiated with the main focus to identify behavioral-based core competencies for MAs of Cincinnati Children's, which led to the standardization of orientation competency documents for all of our MAs. The first step was to examine clinical tasks completed by MAs across the organization. Clinical managers were asked to provide that information to the MA Core Competency Task Force. Based on those frequently completed clinical tasks, the task force identified 4 core competency groups. One of the groups was patient care skills, which involved vital signs and anthropometrics. Another group is computer documentation. That's our electronic medical record, of which we use Epic at our institution. The third core competency was communication, which involved a variety of things, from the use of interpreter services, communication with diverse patient and families, and communication amongst the whole entire healthcare team. And the fourth competency is age-specific care, in which we provide care based not only on age, but the developmental level of the patient. With support from patient services leadership, the Medical Assistant Blitz program was developed. MAs from across the organization attended a 4-hour Blitz session. They rotated through 5 skill stations along with a hands-on computer documentation training. Age-specific care was incorporated into the skill stations using different patient scenarios. Our skill stations were led by ambulatory educators and ambulatory nurses, otherwise known as the RN champions. Step-by-step instruction sheets were utilized by the skill station trainers to promote standardization amongst those trainers and the medical assistants. Each MA was evaluated using the simulation assessment core competency tool you see on this slide. Evaluation was based on a 3-point Likert scale, in which a 3 indicated that the MA was able to complete the skill independently. A 2, the MA needed some additional coaching prior to demonstrating the skill, but ultimately they performed the skill independently. Or a 1, in which the MA needed coaching prior to and throughout. To evaluate skill performance, MAs were evaluated using the simulation assessment core competency validation tool as discussed on the previous slide. The average score of all 14 patient care items was 2.84 on a 3-point Likert scale. And as you can see from the highlights here, the highest mean score was our standing weight, and our lowest mean score was obtaining a segmental length. To evaluate the impact of the training session on confidence level, MAs completed an online pre- and post survey at the training session. After the welcome, each MA in attendance for that session was emailed a link to complete the pre-survey. And then at the end of the session, each MA completed the post-survey. Survey results showed that the competency-based intervention yielded statistically significant improvements in confidence levels and knowledge. Feedback gathered from verbal comments and survey results was positive overall. By offering the Medical Assistant Blitz program, Cincinnati Children's was able to operationalize the standard behavioral-based core competencies for all MAs. MAs had the opportunity to increase their confidence and knowledge performing those competencies. They also had the opportunity to network with other MAs from across the organization. Annual core competency validation of all MAs will take place during the month of September. During that time, the MAs will attend a 1-hour challenge session. Ultimately, Accountability for core competency maintenance resides with the clinical director or manager and education specialist. If you have any questions or for more information, feel free to contact us at ambulatory_service_educators@cchmc.org. Thanks.